So my talk will focus on discussing combination therapies for cancer treatment, the challenges that we face with that and our approach to tackling that. So we know that targeted agents have the potential to improve patient responses, but unfortunately cancer is a complex disease. We know that tumour heterogeneity and the tumour microenvironment can mean that often those responses are short-lived. Our aim is to, by combining drugs, is to try and make sure that those responses are either more durable or deeper. So another challenge we face is the emergence of resistance, and what we hope is by generating combinations we can maybe target two of those pathways and prevent the development of that resistance. Unfortunately, developing combinations is no small task. What we know is that there are a huge number of combinations that we could look at, and really what we need to do is work out which ones are the best combinations for patients. What we need to make sure is that we optimise how we develop those combinations by looking at both the dose and schedule and the right patient populations to make sure that we gain maximum benefit. We also need to identify biomarkers we can use in the clinic. With two or more drugs in a combination, what we need to do is ensure that both agents are targeted appropriately so that patients gain more benefit than either agent alone. So even with robust prioritisation preclinically, what we need is more effective ways of testing these agents in the clinic. Our approach to this is to look at platforms. These uniquely allow us to test more than one combination in a disease setting, and therefore allow us to effectively signal search in a certain population. What's also important is that protocols written flexibly so that as we generate new agents and new hypotheses, we can add new arms to that study. As mentioned previously, ensuring that those studies are biomarker rich is essential so that we can both understand the disease and the agents that we're developing and any pathways of resistance that develop to those agents. Despite the challenges faced, we hope that this approach will mean that we can get efficient, effective and well-tolerated combinations to patients quickly.